Welcome to the Prepared Mind, Edward Jenner's origin story and the making of a scientist. This opening slide sets the stage for exploring the foundational experiences that shaped the pioneer of vaccination. Blending nature with biology, the central engraving seamlessly joins a tranquil rural landscape with a detailed anatomical heart rooted directly into the earth. It symbolizes how keen observation of the natural world and human anatomy prepared Jenner's mind for groundbreaking scientific discovery. Here in Deconstructing the Myth of the Lucky Doctor, we challenge the popular belief that Edward Jenner's breakthrough was mere serendipity based on milkmaid folklore. On the left, the myth frames him as a simple country doctor making a lucky guess. On the right, the reality reveals a meticulously trained empiricist who spent decades assembling a scientific toolkit of comparative anatomy, taxonomy, empirical observation, and controlled trials. His discovery was no accident, but a deliberate, methodical triumph over the greatest medical crisis of his era. Born in Gloucestershire in 1749 and orphaned at age 5, Edward Jenner faced a defining trauma at just 8 years old. Subjected to 18th-century variolation, he was starved, bled, and purged before being deliberately infected with live smallpox material. Though Jenner survived, the brutal ordeal permanently damaged his health, leaving him with lifelong tinnitus and a profound dread of crude medical practices. This early agony forged his lifelong mission: to replace dangerous, traumatic procedures with a far safer way to protect humanity from disease. Apprenticed at age 13 to surgeon Daniel Ludlow in Chipping Sodbury, Edward Jenner spent 7 years mastering anatomy, complex surgeries, and botanical remedies. During this clinical training, he repeatedly heard local dairymaids claim that contracting mild cowpox protected them from deadly smallpox. While conventional physicians dismissed the notion as mere peasant superstition, Jenner recorded the observation with an open mind. Though he still lacked the scientific framework required to test the theory, this vital intersection of practical medical training and rural folklore laid the groundwork for his eventual revolutionary discovery. In 1770, Edward Jenner arrived at St. George's Hospital in London to complete his medical education under John Hunter, the 18th century's preeminent surgeon and anatomist. Becoming Hunter's pupil and first live-in lodger, Jenner was deeply influenced by his mentor's philosophy that anatomy must be comparative and surgery grounded in biological function rather than mere mechanical cutting. This pivotal partnership transformed Jenner from a skilled rural apothecary into a rigorous, modern scientific investigator. This slide illustrates a fundamental turning point in medical science, contrasting traditional 18th-century practice with Hunterian empiricism. While traditional medicine relied on ancient dogma, theoretical humors, and dismissed rural folklore, Hunter's empirical model demanded rigorous observation and experimentation. It viewed humans through comparative anatomy, recognizing that all living creatures share underlying biological rules. Crucially, Hunterian empiricism treated folk wisdom not as peasant myth, but as testable hypotheses, providing Jenner with the scientific framework to transform local observations into revolutionary medical discovery. In 1771, following Captain James Cook's return aboard the Endeavour, Sir Joseph Banks entrusted the young Edward Jenner with cataloguing vast collections of exotic botanical and zoological specimens. Through this assignment, Jenner mastered the art of meticulous biological classification. Though invited to join Cook's second voyage as official naturalist, Jenner made a pivotal decision. He declined global exploration to apply this newfound scientific rigor to the local ecosystem of Gloucestershire. At the heart of John Hunter's guidance to Edward Jenner was a radical challenge: why think, why not try the experiment? This slide illustrates Hunter's core empirical cycle: observe local phenomena, formulate hypotheses without bias, test theories in the physical world, and refine understanding through anatomical evidence. By tasking Jenner to run continuous, controlled experiments using local wildlife, Hunter instilled an action-driven scientific discipline that replaced mere speculation with rigorous empirical inquiry. In the 18th century, smallpox was an endemic terror across Europe, causing 400,000 annual deaths, a 30% mortality rate, widespread blindness, and severe childhood fatalities. Amidst this devastation, Dr. Edward Jenner observed a critical anomaly in Berkeley, Gloucestershire. Milkmaids who contracted mild cowpox from cattle never caught lethal smallpox. Guided by John Hunter's famous challenge, "Why think, why not try the experiment?" Jenner recognized that this localized observation held the key to confronting one of humanity's deadliest diseases. This slide illustrates a monumental paradigm shift in medicine, contrasting traditional variolation with Edward Jenner's revolutionary vaccination. Traditional variolation used dangerous human smallpox material, carried a 1 in 50 mortality rate, required strict 14-day isolations, and remained an expensive privilege controlled by physicians. By replacing smallpox with bovine cowpox fluid, Jenner's innovation proved completely safe and non-contagious to others. Crucially, vaccination democratized medicine, transforming a costly, high-risk procedure into a universally applicable protection that Jenner offered freely to the world. In assembling The Investigator, we see how 4 distinct streams of experience converged through the Hunterian method to forge a unique scientific mind. Jenner's childhood familiarity with rural ecosystems, 7 years of clinical training under Ludlow, mastery of global taxonomy from Cook's expedition, and Hunter's mandate for empirical experimentation aligned perfectly. This powerful synthesis provided Jenner with the precise combination of rural access, surgical skill, and scientific rigor needed to solve the cowpox puzzle and conquer smallpox. On May 14, 1796, Edward Jenner put theory into practice in the inevitable experiment. Observing cowpox lesions on dairymaid Sarah Nelms, contracted from a cow named Blossom, Jenner extracted the material and inoculated 8-year-old James Phipps. After Phipps safely recovered from mild cowpox, Jenner delivered the ultimate test weeks later by variolating him with deadly smallpox material. Phipps remained completely healthy, conclusively proving that cowpox conferred immunity against smallpox and ushering in a new era for medicine. In the mechanics of cross-immunity, we see how Edward Jenner demonstrated the foundational principle of modern immunology. In May 1796, after extracting cowpox material from milkmaid Sarah Nelms, Jenner inoculated 8-year-old James Phipps. By exposing Phipps to a mild animal pathogen, his body safely learned to defend itself. 6 weeks later, when exposed to lethal smallpox, his trained immune system blocked the virus entirely. Jenner proved that a mild, cross-reactive animal pathogen could safely train human defenses against a deadly disease, laying the cornerstone for modern vaccination. In his Berkeley garden stood the Temple of Vaccinia, recognized as the world's first public health clinic. Driven by an ethos of equity, Edward Jenner provided free vaccinations to the rural poor, with queues stretching deep into town. Refusing to patent his revolutionary breakthrough, he championed open-source medicine, becoming the vaccine clerk to the world by freely mailing dried cowpox lymph on threads and glass. Jenner ensured his life-saving discovery was a gift to all humanity. Without refrigeration, transporting perishable cowpox lymph across vast oceans posed a monumental challenge. The Spanish Balmas expedition solved this with a living chain of arm-to-arm transmission. 22 orphaned boys from Spain and 3 enslaved girls from Cuba served as living vessels. By sequentially inoculating 2 children at a time and using fluid from their fresh lesions to vaccinate the next pair, this human chain kept the vaccine biologically active across the Atlantic and Pacific Oceans, carrying smallpox protection all the way to China. In a unified front against an endemic terror, Edward Jenner's discovery united a divided world, transcending geopolitical conflict. In the United States, President Thomas Jefferson vaccinated his family and established the National Vaccine Institute. In France, despite being at war with Britain, Napoleon Bonaparte vaccinated his army, declaring smallpox a foe greater than war itself. By 1805, millions of children were immunized worldwide. Jenner's philanthropy proved that defeating global health threats requires dismantling political boundaries, establishing an enduring precedent for international medical cooperation. Despite its proven efficacy, vaccination faced fierce public backlash and fear. James Gillray's famous 1802 satirical etching, "The Cowpox," mocked the practice by depicting patients wildly sprouting cows from their bodies. Yet against this wave of ridicule and resistance, Institutional support prevailed with the founding of the Royal Jennerian Society in 1803. Backed by royal patronages, the society helped overcome public skepticism, standardizing vaccination and securing a decisive victory in the long fight to eradicate smallpox. In the economic thread of Jenner's discovery, we explore how vaccination challenged the medical establishment. Traditional variolation was a lucrative business for elite physicians, relying on expensive, dangerous procedures using live smallpox virus that required long quarantines. Jenner's cowpox vaccine disrupted this monopoly by offering a safe, non-contagious, and highly effective alternative, provided cheaply or completely free. Ultimately, Jenner's innovation was not only a medical triumph, but a devastating economic threat to an industry built on costly, high-risk treatments. Edward Jenner's fight for vaccination was waged across a three-front war. Professionally, rival London physicians like George Pearson and William Woodville attempted to usurp his work, with Woodville even accidentally contaminating early trials with live smallpox. Socially, intense paranoia gripped a public terrified that injecting bovine matter would transform them into beasts. Philosophically, clergymen condemned using substances from lower animals, while German critics vilified the method as Brutalimpfung, beastly inoculation. Yet against this fierce resistance movement, Jenner's life-saving science ultimately prevailed. In visualizing the public sphere, James Gilray's satire captures the deep-seated panic surrounding early vaccination. On the left, frightened young women received cowpox inoculations at St. Pancras Hospital. On the right, terrifying metamorphoses erupt as miniature cows burst from the mouths, arms, and noses of patients, a vivid manifestation of the public's dread of bestialization. On the desk, tubs labeled opening mixture and vomit mock the crude, visceral nature of the procedure, brilliantly illustrating the irrational fears Jenner had to overcome. In visualizing the public sphere, James Gilray's satire captures the deep-seated panic surrounding early vaccination. On the left, frightened young women received cowpox inoculations at St. Pancras Hospital. On the right, terrifying metamorphoses erupt as miniature cows burst from the mouths, arms, and noses of patients, a vivid manifestation of the public's dread of bestialization. On the desk, tubs labeled opening mixture and vomit mock the crude, visceral nature of the procedure, brilliantly illustrating the irrational fears Jenner had to overcome. To overcome entrenched institutional and social resistance, Edward Jenner weaponized elite patronage and military endorsement. Shielded beneath the protective umbrella of royal backing, including King George III, Queen Charlotte, and the Prince of Wales, vaccination stood firm against a barrage of hostile pamphlets and satirical attacks. Furthermore, securing the endorsement of the Duke of York, Commander-in-Chief, led to the immediate vaccination of the 85th Regiment. By mobilizing the highest levels of crown and military authority, Jenner effectively neutralized opposition and cemented vaccination's legitimacy. In 1803, the founding of the Royal Jennerian Society institutionalized vaccination by securing the highest levels of elite endorsement. With the king and queen serving as patrons, royal princes as vice-patrons, and prominent nobility acting as sub-patrons, the procedure underwent a masterclass in rebranding. By embedding the medical breakthrough within the British aristocracy, vaccination was instantly elevated from a dismissed, beastly rural folk remedy into a fashionable and patriotic duty. In The Saboteur's Last Stand, rival Dr. George Pearson attempts to undermine Edward Jenner by bringing Dorset farmer Benjamin Jesty before Parliament to prove Jesty had used cowpox back in 1774. However, Jenner's allies successfully defend his legacy. They demonstrate that while rural figures made isolated observations, Jenner was the first to systematically test the procedure, scientifically validate arm-to-arm transmission, and freely share his methodology with the world. Ultimately, rigorous science outweighs mere precedents. In the state's validation, scientific truth triumphs over disinformation and professional rivalry as the British government officially steps in to endorse Edward Jenner's work. In 1802, Parliament rejected attempts to sabotage his reputation, awarding Jenner £10,000 to compensate for his abandoned private practice. By 1807, after the Royal College of Physicians published an exhaustive report confirming the vaccine's safety, Parliament granted an additional £20,000. Through this unprecedented financial backing and institutional recognition, the state permanently secured vaccination as a vital public health triumph. In the dual legacy, biology and philosophy, Edward Jenner's impact extends far beyond smallpox eradication. Biologically, his concept of cross-immunity laid the foundation for modern vaccines, from polio to mRNA platforms. Philosophically, his refusal to patent the discovery established health equity as a core public health principle. Ultimately, Jenner's greatest contribution was creating a global health framework, proving that while a virus can be eradicated, sustaining vaccine competence requires continuous commitment. In 1773, Edward Jenner returned to Berkeley, balancing clinical practice with natural science. As a physician, he identified coronary artery ossification in angina pectoris in 1778 and refined the preparation of tartar emetic in 1783. As a naturalist, he investigated hedgehog hibernation and solved the mystery of cuckoo brood parasitism, earning election as a Fellow of the Royal Society in 1788. Unifying these dual tracks, Jenner viewed humans and animals as part of a single, interconnected biological system, a foundational mindset for his future discoveries. Far from being an isolated country doctor, Edward Jenner transformed the English countryside into a thriving scientific hub. Despite leaving London, he maintained a rigorous intellectual network, co-founding the Fleece Medical Society with colleagues like Dr. Caleb Hillier Perry. Gathering regularly at the Fleece Inn in Rodborough, the group met to dine, read papers, and debate medical advancements, spanning from valvular heart disease to Jenner's earliest observations on cowpox. Through this active, peer-reviewed circle, Jenner grounded his groundbreaking research in collaborative, continuous scientific dialogue. 180 years after the vaccination wars began, the ultimate victory was sealed. In May 1980, the World Health Assembly officially declared smallpox eradicated from the earth. Edward Jenner's determination, weathering intense ridicule while ensuring his vaccine was freely available to all, ultimately saved hundreds of millions of lives, delivering humanity's definitive triumph over an ancient scourge. Unfortunately, much of this work has been undone by the anti-vaxxer movement as smallpox is once again thriving in the human population.